Okay, get ready because today we're going deep on a topic you might think is, well, ancient history, diphtheria. But here's the thing. This blast from the past is back, and we need to figure out why.
Yeah.
We've got, well, some alarming reports from the World Health Organization, a bunch of research papers, even a potential herbal remedy from the Lost Book of Herbal Remedies to unpack. What we found in all these sources is both a bit scary and honestly a little surprising.
What's interesting is we were so close to wiping out diphtheria,
Right.
thanks to vaccines, but now we're seeing it come back,
Really?
especially in places where, vaccination rates have dropped. And this isn't just happening in, remote parts of the world,
Right.
We're seeing cases pop up in Europe, even Canada.
So are we saying there's a direct link between this drop in vaccination and the rise in cases?
Yeah.
What's the research say about that?
The research is pretty clear on this. The
Yeah.
World Health Organization and UNICEF have reported that vaccination rates kind of stalled in 2022, 2023. Only about 89% of children are getting their first dose of the diphtheria, tetanus, pertussis vaccine, which that's a big drop from before the pandemic.
I remember learning about diphtheria in school like it was, something from the past. It's a little unnerving to see it making a comeback.
Yeah.
And we're talking about millions of kids who are now vulnerable to this, right?
Yeah, unfortunately, yes. And to make things even more complicated, diphtheria isn't always just, a sore throat.
Right.
It can actually affect the skin, too, which makes it harder to diagnose.
Oh, wow.
We're seeing a rise in cases of what's called cutaneous diphtheria, which, it often looks like other skin infections.
So if it's not always so obvious, how is it diagnosed?
Doctors will look for the classic symptoms like the pseudomembrane in the throat.
Yeah.
But to really confirm if the bacteria is there, they need to analyze samples, lab tests.
Yeah.
And this can be tricky because the traditional test for detecting the diphtheria toxin called the ELEC test
Right.
is becoming less common.
For our listeners, you might be wondering, well, what is the ELEC test? Why is that a problem?
Yeah.
Well, it's a lab test that uses antibodies to detect the toxin from the bacteria.
Right.
But things like limited antitoxin availability, fewer labs doing the test, it's making it harder to get a quick and accurate diagnosis.
Absolutely. And that timely diagnosis is super important for effective treatment.
Right.
Antibiotics are a critical part of the treatment plan.
Of course.
They're not the whole story. The key is to catch it early, especially in severe cases where doctors need to administer the diphtheria antitoxin.
Right.
That antitoxin works best when it's given early on to neutralize the toxin produced by the bacteria.
Okay, so let's talk about the Lost Book of Herbal Remedies.
Yeah.
It mentions this herbal formula that could potentially help the body fight off diphtheria. This formula includes herbs like golden seal, echinacea, licorice root, herbs that are known for their antimicrobial and immune-boosting properties.
Right.
It's pretty interesting.
It is. And while antibiotics are definitely essential, the potential of these herbs to, complement conventional treatment is worth exploring. For example, golden seal contains berberine, which has shown antimicrobial activity against various bacteria, including the one that causes diphtheria.
And echinacea is, pretty well known for boosting the immune system.
Yeah.
So combining these herbs with traditional treatment could be a powerful approach, right?
It could, yeah. But it's so important to talk to healthcare professionals before using ANOI herbal remedies,
Yeah.
especially for kids.
Of course, herbal remedies are not a replacement for conventional medical care.
Yeah.
Always use them under the guidance of a qualified healthcare professional.
Exactly.
Okay, let's shift gears a bit. Let's talk about one of the main reasons behind diphtheria's comeback. Vaccine hesitancy. This hesitancy, a lot of times fueled by, misinformation,
Yeah.
impacting communities all around the world.
You're right. Vaccine hesitancy is a huge concern, and it goes beyond just individual choices.
Right.
It's a public health issue with wide-reaching consequences.
Right.
There are many things driving this hesitancy, from worries about safety to distrust in the healthcare systems and all the misinformation online.
It's like this perfect storm brewing.
Yeah.
We've got this disease making a comeback, and at the same time, we have people hesitant to get vaccinated. What are we doing about this globally?
The global health community is, working hard to address this. They've launched initiatives like what they're calling the Big Catch-Up to get vaccination rates back up to where they were pre-pandemic.
Mm-hmm.
But it's not as easy as just making vaccines available.
Right.
It needs a multifaceted approach.
So it's not just about access, it's about trust. Right?
Yeah.
And tackling misinformation head on, that's a huge challenge. What does that look like in practice?
It involves a lot of different strategies, increasing access to the vaccines, especially in remote or underserved areas.
Right.
Training healthcare workers, educating the public about why vaccination is so important, and, of course, addressing the spread of misinformation.
Right.
It's a huge undertaking.
Now, for our listeners, this brings up an important question.
Yeah.
If you're looking for good information about diphtheria and vaccination, where do you go?
Well, the World Health Organization, WHO, and the Centers for Disease Control and Prevention, CDC,
Right.
they're excellent resources for accurate and trustworthy information.
Right.
They have great websites dedicated to diphtheria, covering everything from symptoms and transmission to treatment and prevention.
Yeah, great. We'll include links to those resources in the show notes for everybody.
Great.
Now, before we move on to the next part of our deep dive,
Yeah.
I want to circle back to the Lost Book of Herbal Remedies.
Of course.
Can you tell us a bit more about the herbs in that formula and, how they might be beneficial?
Yeah.
I know our listeners are always interested in learning more about the power of plants.
In addition to the golden seal and echinacea we discussed earlier, the formula includes licorice root, known for its soothing and anti-inflammatory properties.
Right.
Garlic, which has, potent antimicrobial effects.
What about thyme? I've heard thyme can be helpful for, breathing problems. Would that be relevant here?
Yes, thyme is a great one to bring up. It's got a lot of thymol, which is a compound with both antimicrobial and antispasmodic effects, which can be really helpful for those respiratory symptoms like, coughing and congestion.
So it sounds like this formula tries to address diphtheria from different angles, right?
Yeah.
Targeting the bacteria, boosting the immune system, and soothing the respiratory tract. It's like this holistic approach.
It is, and it really highlights the potential of combining that traditional herbal wisdom with, modern medical knowledge. Again, we can't stress enough, talk to your doctor before using any herbal remedies, especially for children.
Absolutely. Now, before we move on, I want to leave our listeners with a question to think about. Given, diphtheria coming back and the challenges with vaccine hesitancy, how do we balance respecting individual choices with protecting public health?
Oh, yeah.
It's a complex issue. No easy answers.
It is. It's a question that requires careful thought and open dialogue.
Right.
Maybe in part 2 of our deep dive, we can, explore some potential strategies. What do you think?
Sounds good. We'll be back soon to continue our deep dive into diphtheria. Stay with us.
Okay. Welcome back to our deep dive into diphtheria.
Before the break, we were talking about the big catch-up campaign, that global effort to boost vaccination rates.
Right.
Increasing access to vaccines is clearly a big part of this, especially in, those hard-to-reach areas.
Yeah.
But what about the people who are hesitant about vaccines?
Right.
Even when they're available, how do we address that?
That's the big question, right? It's not just about logistics. It's about building trust, We have to remember that vaccine hesitancy often comes from these deep-seated fears and distrust.
So how do we even start to approach that?
Right.
It seems like a very sensitive personal issue.
It is, and it requires a lot of empathy and understanding.
Right.
We need to create spaces where people feel safe to ask questions.
Yeah.
Voice their concerns, get accurate information from sources they trust. This means engaging with communities, building relationships, and tailoring communication strategies to really connect with different groups.
You mentioned earlier that cutaneous diphtheria is becoming more common, especially among refugees. Can you tell us more about why this particular form of diphtheria is on the rise?
Well, it's a few things. But a big one is the weakened immune systems, often seen in refugee populations.
Right.
Many refugees have dealt with things like malnutrition, limited access to health care, which can compromise their immune systems, make them more vulnerable to infections.
So they're more susceptible to infections in general.
Yes.
And that includes cutaneous diphtheria.
Exactly. And to make matters worse, cutaneous diphtheria often has symptoms that, mimic other skin infections,
Wow.
which can lead to misdiagnosis and delays in treatment.
That's a huge problem.
It is.
So what needs to happen?
Well, healthcare professionals need to be more aware of the subtle signs of cutaneous diphtheria so they can, diagnose it quickly. Early diagnosis and treatment are so important to prevent complications,
Right.
especially in vulnerable groups like refugees.
So we need like a multi-pronged approach.
Yes?
Improve living conditions, strengthen immune systems, increase access to healthcare, educate healthcare providers.
You got it. It's a complex issue that needs a comprehensive solution.
And wouldn't widespread vaccination play a role in preventing these outbreaks in the first place?
Absolutely. If more people were vaccinated, we'd see a significant drop in diphtheria cases.
Yeah.
Including these cutaneous cases.
Right.
Vaccination is still the most effective way to protect ourselves and our communities.
Which brings us back to that challenge of vaccine hesitancy.
Right.
It's like this vicious cycle. Outbreaks happen, which leads to fear and concern, but that fear fuels hesitancy, making future outbreaks more likely.
Yeah, it's this complex mix of social, psychological, and epidemiological factors.
Right.
We need to find ways to break that cycle.
Right.
And build a culture of vaccine confidence.
Right.
Based on trust and transparency.
Speaking of trust and transparency, we were talking earlier about the decline in the ELIC test.
Yes.
How does that lack of reliable testing make the problem worse?
It's a huge issue. Without, timely and accurate diagnosis, treatment can be delayed.
Right.
And the infection can spread more. This is especially concerning in places with limited healthcare resources.
Yeah.
Where quick and reliable testing is so crucial.
So it sounds like we need more investment in, diagnostic tools, training for healthcare professionals, particularly in those vulnerable areas.
Absolutely. We need to give those healthcare providers the tools and knowledge to identify and treat diphtheria effectively.
Now let's step back and think about the bigger picture.
Okay.
What are the economic consequences of diphtheria outbreaks? We often focus on the health impacts.
Right.
But I imagine there's a significant financial toll as well.
You're right, there is. Outbreaks can really strain healthcare systems.
Right.
Leading to increased hospitalization costs. Plus, you have low productivity because people are sick and can't work.
Yeah.
It can also disrupt travel and trade, impacting businesses and economies.
Wow.
Remember that diphtheria outbreak in Bangladesh in 2017, 2018?
Yeah.
They estimated that it caused an economic loss of over $13 million.
Wow, that's a huge amount.
It is.
It really emphasizes the importance of, investing in prevention.
Exactly. Prevention is always better than cure.
For human health and economic well-being, vaccination programs might seem expensive up front.
Yeah.
But they're nothing compared to the cost of a full-blown outbreak.
It's like that saying, an ounce of prevention is worth a pound of cure.
Exactly.
But prevention depends on accurate information.
Right.
And, informed decision-making. How do we fight the spread of misinformation?
Right.
Especially, with social media these days.
That's one of the toughest challenges we face. Technology has been amazing for connecting people and sharing information.
Yeah.
But it's also created this breeding ground for misinformation.
So it's like a double-edged sword, right?
Yeah, right.
How do we, navigate this and make sure people have access to good information about vaccines?
Right.
About diseases like diphtheria?
We need to promote media literacy.
Yeah.
And critical thinking skills.
Okay.
We need to teach people how to evaluate information sources.
Yeah.
Identify bias and tell fact from fiction. So it's not just about giving the right information.
No.
It's about giving people the tools to figure out what's what, right?
Exactly. We need to empower people to be critical thinkers.
Yeah.
To question what they see and hear and to, look for evidence-based information.
And that includes knowing where to find those reliable sources.
Yes.
Like the WHO and CDC websites we talked about.
Exactly.
Speaking of reliable sources, we've been talking about the Lost Book of Herbal Remedies.
Yeah.
And its potential role in helping the body fight diphtheria.
Right.
It's an interesting idea, but it's important to be careful.
Absolutely. While traditional herbal remedies can offer valuable insights, it's crucial to remember that they should never replace conventional medical care.
Right.
Especially in a serious condition like diphtheria.
So how should people approach information about herbal remedies?
Yeah.
Especially for something as serious as diphtheria.
The key is to be informed and to talk to their healthcare provider.
Yeah.
Don't self-treat. Especially when it comes to children.
Yeah.
Herbal remedies can interact with medications. And they might not be right for everyone.
It sounds like a balanced approach is important.
It is.
Respect traditional knowledge, but also rely on, evidence-based medicine and consult with qualified healthcare professionals.
Exactly. It's about finding that balance where traditional wisdom and modern science can work together.
Okay, we've covered a lot in this part of our deep dive. We've explored cutaneous diphtheria, the economic impacts of these outbreaks, the fight against misinformation, and the balance between traditional remedies and modern medicine. But there's still more to discuss.
You're right. In the final part of our deep dive, I want to look at some of the ethical considerations surrounding vaccination policies.
Yeah.
We'll also look at the research being done to develop new and better vaccines and treatments for diphtheria.
Sounds good. We'll be right back after a short break to continue our exploration of diphtheria. Don't go away. Welcome back to the deep dive. We've been talking about the comeback of diphtheria, a disease that many of us thought was a thing of the past. It's been fascinating, but honestly kind of unsettling too.
Yeah, it is unsettling to see a disease that we almost eradicated, making a comeback like this. But understanding why this is happening, all the reasons behind it, that's crucial for, figuring out how to deal with it effectively.
Definitely. And in this last part of our deep dive, we wanted to explore, some of the ethics involved in like vaccination policies and also look ahead to the future of research on diphtheria.
Yeah, one of the biggest ethical questions we're facing is how do we balance individual freedom with, the good of everyone when it comes to vaccination?
Right.
Mandatory vaccination policies have been proven to work to control outbreaks.
Yeah.
But they often spark debates about personal liberty and government overreach.
Yeah. It's a tough balancing act, isn't it?
Yeah.
On one hand, we have the right to decide what happens to our bodies, our health care.
Right.
But on the other hand, we have a responsibility to protect our communities, especially those who, are the most vulnerable, who can't get vaccinated for medical reasons.
Absolutely. It's about finding that balance.
Yeah.
Respecting individual rights, but also, keeping public health safe.
Right.
Open and honest conversations are so important.
Right.
Engaging with communities, giving clear, transparent information about vaccines and how they protect us all.
Transparency and trust, definitely key. But beyond the ethical stuff, there's also the economic impact of diphtheria outbreaks to think about.
Right.
We've talked about the cost in terms of human health.
Yeah.
But what about the financial burden?
Oh, the financial burden is huge. Outbreaks put a strain on healthcare systems.
Yeah.
Which means more hospitalizations and treatment costs. They can also disrupt, the workforce, impact productivity, and lead to, financial losses for individuals and businesses.
So the economic argument for prevention through vaccination is, pretty strong.
It is.
Investing in vaccines isn't just about public health. It's an economic necessity, too.
Exactly. Prevention is always the most cost-effective approach.
Okay, so let's shift our focus to the future. What's happening in diphtheria research? Any new vaccines or treatments in the pipeline?
Yeah, there's some exciting research going on. Scientists are always working to make existing vaccines better,
Right.
and develop new ones that are even more effective, last longer, and are easier to administer.
Can you give us some examples of, what they're working on specifically?
Sure. Some promising areas of research include, developing vaccines that target specific parts of the diphtheria toxin, creating vaccines that can be delivered through, nasal sprays or skin patches.
Oh, wow.
And exploring the potential of, DNA vaccines.
Sounds like the scientific community is, really trying to stay ahead of this reemerging threat.
They are. And in terms of treatment, there's ongoing research into new antibiotics that work against drug-resistant strains of the diphtheria bacteria,
Right.
as well as developing new antitoxins that can neutralize the toxin better.
So it's a two-pronged attack: prevention with better vaccines and better treatment options.
Exactly. And it really shows the ingenuity and dedication of scientists all over the world who are working so hard to protect us from this potentially deadly disease.
Well, we've covered a lot of ground in our deep dive into diphtheria.
Yeah.
The history, the science, the challenges, and the hopeful developments. What are some, key takeaways for our listeners? What do we want them to leave with?
Well, first and foremost, awareness.
Right.
Diphtheria is back, and we can't afford to ignore it.
Yeah.
We need to stay informed,
educate
educate ourselves, and have, thoughtful discussions about vaccination and public health.
And be proactive, right? Don't wait for an outbreak to happen in your area before you start asking questions.
Exactly.
And looking for reliable information.
Knowledge is power.
Right.
The more we understand about diphtheria, the better we can protect ourselves and our loved ones.
We've talked about a lot of resources during this deep dive, from the World Health Organization to the CDC. And of course, there's the Lost Book of Herbal Remedies, which offers a different perspective, traditional approaches to supporting the body's natural defenses.
Right, and remember, when it comes to health information, especially about serious conditions like diphtheria, always talk to your doctor.
Absolutely. They can give you personalized guidance and help you make good decisions about your health.
It's been a really interesting discussion.
It really has, and it highlights something really important. In a world where information is everywhere, critical thinking and reliable sources are more important than ever.
Absolutely.
Diphtheria's resurgence is a wake-up call. It reminds us that even diseases we thought we'd beaten can come back if we're not careful.
It does.
Yeah.
But it also shows, human resilience and the power of science. We have the tools to fight back, to prevent suffering, and to protect future generations. It's up to us to use them wisely.
Well said. Thanks for joining us on this deep dive into diphtheria. We hope you found it informative and something to think about. Stay curious, stay informed, and stay healthy.